Remaining under motions and resolutions, we will take up the Conference Committee report on Senate File Number 1. Senator Benson.
Thank you, Madam President. I move that the foregoing recommendations and Conference Committee report on Senate File 1 do now be adopted and that the bill be repassed and as amended by the Conference Committee.
On that motion, Senator Benson.
Thank you, Madam President. Senate File 1 was brought to the floor to address 4 problems: premium increases, sudden changes in access, uncertainty and instability in the market, and a lack of options in Greater Minnesota. In conjunction with the House and working with the Governor, we return with this Conference Committee report that is beginning to address 3 of those 4 concerns. We have nearly $312 million for premium relief delivered as the Governor had desired from the beginning. We have nearly $15 million to assist in the continuity of care, which was in the original bill. Additional provisions added in Conference Committee were surprise billing provisions that had moved through the House and were agreed on by the Conference Committee, and a provider's ability, again a House provision, that gives providers the ability to appeal network adequacy waivers distributed by the Minnesota Department of Health. I would like to note for members 2 significant provisions that are not in this bill. There was an amendment added to the House that has been referred to in many of your emails as the Drazkowski Amendment. That is not in this bill. And the other provision, it left the Senate floor, it was our Article 3, the reinsurance article. That has been removed per the Governor's request. We have a commitment from the House to continue to work on reinsurance as a market stabilization tool, and we thank the Governor and his commissioners for beginning to lay out possible steps for dealing with a market stabilization mechanism. And with that, Madam President, I am happy to stand for questions.
Further discussion on the motion.
President.
Senator Marty.
Madam President, I move that the recommendations on Conference Committee report on Senate File 1 be rejected and the bill be re-referred to Conference Committee as formally constituted for further consideration.
To that motion, Senator Marty.
Thank you, Madam President. Like Senator Benson, I think everybody in the chamber wants to make sure we provide some premium relief for people. I'm glad the decision was made to go ahead in a way that will make that actually happen this year instead of next year. But that's a one-time thing, and there are some other things that are permanent in this bill. I don't call them reforms, particularly one of them, and I would ask that we send the bill back about one of them in particular, and that's the one to allow for-profit insurance companies into Minnesota. This is a thing that the proponents say is going to increase competition for the people trying to buy plans. This is also something that, if you look at for-profit insurance companies, take a poll of your constituents. How many of them think they're on your side on health care? Their job, their fiduciary responsibility to their shareholders to make a bigger profit can come 2 ways: either charging higher premiums or cutting back what they pay out in claims and services covered and so on. They are not health care providers. They don't provide any health care. They take a cut off the top, and they're trying to maximize the cut off the top to maximize their profits. It's something that we have a one-time rate relief in this bill, and with this provision we have something that next year is going to make the system more expensive, more convoluted, and less in the public interest. And again, if you think I'm wrong, ask people in other states about Cigna or Anthem or WellPoint. Ask them about the for-profit insurers. Ask them if they think their concern is you, the patient who's trying to pay rates, if their concern is you who is trying to file claims and get them paid. Ask them if that's what they want, because that's a permanent change you're making here. And there are other consequences that we haven't discussed. Actually, we didn't discuss any of that. I serve on both the Health and Human Services Committee and on the Finance Committee, and I didn't hear any discussion of that. I didn't hear any testimony about that. Didn't hear anything. I think it was taken out of the bill before we ever got to see it, and we never talked about it. But what about the nonprofit health insurers in Minnesota who hold, in some cases, billions of dollars of public, meaning either their members or much of it came from public programs. Huge chunks of it came from public program reserves. Those reserves or assets, whatever you want to call them, those are public. Those, under our nonprofit laws, belong to the people. It's supposed the cause of that nonprofit. If we allow them to convert in our laws on conversion, I'm not the lawyer, but I know our laws on conversion aren't very clear and very strong. Do they take those billions of dollars and turn them over to their executives? Do they turn them over to their shareholders? Have we discussed that? Has any member of the Senate discussed that? I haven't seen it. I haven't heard it. I think these are huge questions. I don't want to delay this. If we send this back today, right now, conference committee could meet. I don't know if it takes them 10 minutes to take it out. Maybe it takes them 15. Send it back here and we can vote on it later. It doesn't have to slow down the process. This is totally unvetted. It's a step backwards. This is not a first step. It's a big step backwards. And again, if you doubt this, just read what people around the country say about these for-profit insurance companies that we are now allowing here as a, quote, reform. I urge you to send it back and ask for a roll call and be happy to stand for questions.
Further discussion on the Marty motion, Senator Limmer.
Madam President, for the purposes of this motion, I impose a call of the Senate.
Senate is under call. And Senator Limmer, did you mean for this motion or Senator Benson's the entire?
Let's just do it for this motion, Madam President, and I'm sure someone will be wanting to impose the same call of the Senate for the remainder of the bill. Madam President, I move that further proceedings under the roll call be dispensed with and the Sergeant of Arms be instructed to bring in absent members.
On that motion, all in favor say aye. Those opposed, no. Motion does prevail. Senator Gazelka.
Thank you, Madam President. Members, a couple of things. First of all, when we passed this off the floor, I didn't hear much discussion of opposition on this portion of the bill. It really had mostly to do with will we take the governor's language for funding, or will we do the Republican language for funding? That was the predominant message that I heard. But I had a visit with Senator Laurie last night, and he expressed some concerns to me. And so this year I hadn't delved deep into it in my role, but I have in the past, and I wanted to go back to this particular issue that Senator Marty brought up as being concerned about. First of all, what I will tell you is relax. This is 49 other states have for-profit HMOs. 49. That means Minnesota is the only one that doesn't have for-profit. And I would tell you that I think you can look up and find negative comments about nonprofit and for-profit and almost every aspect of our present health care system people are incredibly frustrated with, which is why we're all here today, which is why we're trying to work through an incredibly difficult issue that we are all engaged in. And another issue that they brought up is what about if a nonprofit HMO in Minnesota decides that they want to become for-profit and take all of their reserves and move it along with them to their profit designation. And looking at different chapters of the law, I've come to the conclusion that if not impossible, has to be darn near impossible, because they're a nonprofit, which means when they dissolve, their reserves go to another nonprofit. They can't take it over with them. And secondly, what I would say is the Attorney General would be actively involved in that that transition if that was to occur. And so I really am not worried about that. But Senator Laurie, you brought up a valid point that made me dig deeper because I wanted to know exactly where are we at. And the final thing I'll say on this point is this was all about negotiation, and I'll say some of that in my close, but everybody gave up a little bit, and that's what compromise is about. We work through a place where we don't get everything we want, but we move the ball forward, and this bill does that.
Senator Schoen.
Well, thank you, Madam President, and Senator Gazelka. I got to tell you, I'm really relaxed because I'm fortunate enough to be probably 10 to 15 minutes from a lot of great hospitals here in the metro. But in greater Minnesota, you know, for the last 4 years, I did sit on health care, and even the discussion of for-profit insurance carriers would leave people pretty angsty and not relaxed. I sent Senator Benson and a couple others an email I received from Mark Paulson, the administrator from the Montevideo Chippewa County Hospital in greater Minnesota. And here's the issue that I am not relaxed about related to this legislation, is we have not had a good vetting of what this means to greater Minnesota. In particular, we don't even have a good vetting of what it means to my hospital in Hastings or Woodwinds in Woodbury. There are plenty of others that the providers are very not relaxed about what it will mean for reimbursements, what it will mean for their ability to provide care and thrive and to stay successful. I talked to Senator Lang this morning that, you think about Granite Falls Hospital, Chippewa County and Montevideo, Benson, Appleton, Olivia, Rice Memorial and Wilmer. They're all independents. They don't have several hospitals the same way that an Alina, a Health East, and some others do. So this is what the one piece that is very troubling that we just don't have the information on. I can go, the ag co-ops, I got to tell you, that's pretty fantastic because I look at it in the same fashion. If you're an individual employer, so when I first started with the city of Cottage Grove, the insurance companies put you in one silo. You have two people that get cancer in your organization, and then you are left with higher premiums for everybody. Schools wanted to do co-ops. Even we wanted to talk about co-ops in even government entities to say, well, what if Cottage Grove and Woodbury got together as two municipalities and purchased insurance together that way to save money, to bring down the cost, to widen and broaden the pool, which is a great thing that the ag co-op could do. And I think we should do it even further beyond the ag co-ops. But the for-profit insurance thing over my last 4 years has really bothered folks. But we've never gotten to the point where we are today because we would have had hearings. There just has not been a lot of clarity. When I talk to the administrators of those hospitals, they're fairly unaware that this was coming down and that it was happening today. Reality is that you do have to pay attention. There's no question about it. But if we had had solid hearings about this issue where people in Minnesota had an opportunity to come in and testify on a large basis rather than in short-term, quick fix, we all want premium relief out. We all know that reforms are going to need to happen. This just is that one piece I think we should send back, support Senator Marty's motion to send this back to conference committee. I'll wait around. If anybody needs to make some phone calls to their administrators like in Alexandria or Morris or anywhere else, you feel free to use my phone.
Senator Laurie.
Thank you, Madam President. I rise in support of Senator Marty's motion to send this back to conference committee, in particular to take care of the, really big change to move to for-profit insurance companies in Minnesota. Senator Gazelka said that we talked last night. We did, and he referenced statute without really citing it. I have yet to see anything in Minnesota statute that would govern a conversion from a nonprofit status to a for-profit status, such as would be allowed if we passed this statute in its current form. And it is pretty commonly held knowledge that, nonprofit entities hold all their assets in trust, and those are assets are irrevocably dedicated as a condition of their tax-exempt status to the specific charitable purposes set forth in their articles of incorporation. And the public is the beneficiary of these trusts. And if we allow nonprofits to convert to for-profit status without being explicit about how that goes, it's not certain that our Attorney General would be involved in that conversation. We should put some of that in our statute. There have been, and to the point about the statement that it would be nearly impossible for this to happen, that's just not the case. This actually has happened in many states, and they've been thoughtful about their approach. California, Florida, Missouri, South Carolina, Massachusetts, D.C. have all put statutes on their books governing conversion from nonprofit to for-profit status for health entities, and they have managed those conversions well. To do this in a manner that we don't put anything in the statute book to govern how those transitions occur is to allow public money held in the public trust for the benefit of consumers to be put directly into the pocket of stakeholders of for-profit entities, and that is not accountable to the people of Minnesota. That is not what they expect of us. I support Senator Marty's motion wholeheartedly and hope that we can take care of at least this one problematic item in this bill before we pass it off the floor today.
Further discussion, Senator Latz.
Madam President and members, I too rise in support of Senator Marty's motion. You know, the discussion we're having here today is emblematic of the reason why we usually have a longer and more considered committee process before proposing changes as dramatic as allowing for-profit insurance companies to come into Minnesota's healthcare market. We have decades of experience in the nonprofit health insurance market, and this is a huge change. To borrow a term that's common now on the national scene, a huge change. And when we go through the committee process, we have ample time for these kinds of issues to be thought about, deliberated, to go back and do some legal research, to look at how other states have handled questions of this nature, to research other states' laws and maybe see how those might fit in the Minnesota statute books to make a change like this, if we were to agree to such a change, safer for Minnesota consumers and Minnesota stakeholders. You know, there were many times when I started out with a bill that I thought was perfect when it was drafted and introduced, and I would go through the committee process, maybe 3 or 4 committees, and it would get changed a little bit each step of the way. And even if I wasn't entirely comfortable with the change that was made, but the committee in its judgment thought that was the right thing to do, you know, that's the process. And by the end of the day, when we get through the Senate floor and conference committee and reconciling versions with the House and taking into account the governor's views on a bill, I have almost always felt that we ended up in a better place, a more sustainable long-term resolution of that policy, of the statutes that were going to become part of our statute books, than when we started out, no matter how confident I was in the way the bill looked when I first drafted it and introduced it. So there's a reason that we go through this committee process. Now, some members on this floor may have more confidence in insurance companies than I have. And they may have more confidence in insurance companies than their own constituents have. In fact, I would submit, if you took a poll of members' constituents and asked them if they've ever had any issues relating to insurance coverage for health care proceedings or needs, care that they wanted to make sure they had covered, I bet you'd find a lot of them that didn't have some great things to say about even the nonprofit insurance companies that denied coverage for a claim or caused them to spend hours and hours sorting through all of the approval process necessary. You go to the Minnesota Medical Association or the Dental Association or the Chiropractic Association, and you ask those doctors if they've had any negative experience with insurance companies trying to get coverage for procedures that they are absolutely professionally certain are the right things to do for their patients, and they spend hours and hours trying to get approvals for that procedure to be covered by insurance. They're not going to have the same confidence in the insurance companies that are nonprofit, that are supposed to be looking out first and foremost for their claimants. You know, Senator Benson was in front of one of the committees in the course of this bill that we have before us today, and she was referring to the continuum of coverage language that we now find on page 19 of the bill, when individuals, have a right to have some of their conditions continued for care during the course of a transition from one health plan to another plan. And, there's a description here: an acute condition, a life-threatening mental or physical illness, pregnancy beyond the first trimester of pregnancy, physical or mental disability, chronic or disabling condition in acute phase, and also makes reference to the rest of the enrollee's life if that's expected to be 180 days or less. And something that Senator Benson said in the committee hearing really struck me. She said, she is confident that the new health plan that will be determining whether to continue coverage will read this language broadly. She was confident that the new insurance companies would read this language broadly so that coverage will continue for that person who is expected to die within 6 months, or is facing a life-threatening mental or physical illness, or an acute condition. And I want to emphasize, when they are in that position, they are not in a great position to spend their last several months or the time during their acute illness fighting with the insurance company or their health plan to make sure they get coverage. Well, there's a certain leap of faith that would be involved in going to a for-profit insurance system, which I would say is an order of magnitude greater than the level of confidence anyone today has in their nonprofit plan covering their conditions. I'm not prepared to make that leap of faith. So I think we need to have a much more serious conversation about whether it's right to move to for-profit health insurance in Minnesota, and certainly that we take enough time to make sure there are appropriate guardrails around the for-profit system so that we don't condemn our constituents to fighting for health insurance coverage when the insurance company's primary purpose for existing under their corporate status as an entity will be to put money, profit into the pockets of their shareholders, not to look out for patients who need health care coverage.
Senator Franzen.
Thank you, Madam President, and I rise to say that I agree with my colleagues. I agree with Senator Marty and a lot of my colleagues in my caucus who have concern about this provision. I served on the conference committee for this bill, and I don't only have concern about this provision, but other so-called reforms that we included in this bill, which should have been narrowly tailored to providing relief to 125,000 Minnesotans who need premium assistance now. I do have the same concerns. I also have spoken to experts who have concerns about the language not being completely vetted and adequate. It should have been its own bill, along with the other reforms that are included in this bill. But in particular, in this provision to allow the nonprofits potentially to convert, or for for-profits to actually sell products in Minnesota, it goes against the values of Minnesotans. We believe that we should have access to health care and that we shouldn't be profiting from that access to health care, and it should be affordable. And here we are today trying to make it affordable for a portion of our population in our state. What I've learned is that this provision, from what it stands today, it does need more vetting, but that the actual practical effects of it could potentially be that you could convert a nonprofit to a for-profit, but we don't have language in the provision to actually show us or tell us how to do that. We also don't know how the HMO taxation would work. I have learned that apparently for-profits can already sell plans in Minnesota. They have their own nonprofit status underneath their for-profit umbrella. So my understanding is that how it works today. But effectively, what this would do was that for-profits can use an HMO license to sell products, for instance, for Medicaid. And we still have some safeguards in Minnesota. We have the Department of Commerce who vets these plans and makes sure that they align with our mandates and our regulations. We're a highly regulated state for healthcare. That's a good thing to protect consumers. So I'm confident that the Commerce Department will continue to vet plans, even if they're for-profit, under this provision potentially. The other part is they would be bidding for business for MA, medical assistant, which again, our government, our state actually regulates that, and it's a competitive bidding process. So I believe we do have some safeguards there that actually let me have a bit of more comfort of having this language included. Not that I agree with it, not that I want it to be in this bill, but in the spirit of compromise, we sat in conference committee and we talked to our colleagues in the House and our colleagues in the Senate who were on the conference committee, and we agreed that there's a lot of tweaks that need to be continued to be made on the bill that you have before you today. We have concerns about unintended consequences. We want to make sure that what we adopt today doesn't continue to have the market, individual market, continue to be unstable. The point of this bill is to provide relief. I don't believe the reforms that we have in this bill today actually do anything to stabilize the individual market. Some of the provisions you'll say, and they are frankly out of scope of this bill. But again, in the spirit of compromise, I support the bill as it is, frankly, because I believe that the biggest point of this bill is to provide relief for 125,000 Minnesotans. That is our first and foremost objective of this bill. And that's what I'm voting for. I'm not voting for having for-profits come into Minnesota. I'm voting for people to get relief today. The lack of public input was also a concern. We sat for 2 days, and we heard from stakeholders, the regular suspects at the Capitol, those who advocate and are paid to advocate on behalf of their potential interest. But I only heard from one Minnesotan, just one, who had no special interest, one individual who came to speak about their own perspective personally. So I think we did not have a real public debate about this. I did get a lot of emails, not thousands, but I'm sure a lot of it collectively, we probably did get thousands of emails on people concerned about the language that came from the House, an amendment that would have taken Minnesota backwards in terms of depleting or taking off the mandated benefits that we so hardly, that we actually fought for Minnesotans. And that was off the table. So I'm glad that we all got that tension from our constituents and other Minnesotans who thought that amendment would have taken Minnesota backwards and would have allowed plans to be sold with less of safeguards and health care. The process was rushed. Frankly, should have been done in special session, but here we are today, and we can't continue to delay this relief. And that is why, even though I support my colleagues in the debate on this provision, I will vote to continue to move forward with this bill. I'm not necessarily opposed to the provision, but again, it still needs further vetting. We need public input, we need stakeholders. We were grappling with this issue. We were grappling with the repealer language that we don't even know, Senate Council couldn't even tell us how that actually would work. We got counsel to even talk to the Attorney General on that provision. So we have questions, and we have a real concern that some of the provisions on this bill may have unintended consequences and do nothing, again, to stabilize the individual market. The stop-loss provision, the surprise billing, the continuity of care, they all sound like great proposals, but again, what do they do for the individual market? I beg the question. I do believe it's not real reform, and there's some merit to all of these, and we made the best, we did the best we could to adopt language that was closer to reality, but we still acknowledged, and our chairs acknowledged, the author in this House and the Senate acknowledged that we still need to work on these. So I would like to ask Senator Benson to yield.
Senator Benson yield.
Thank you, Madam Chair. Senator Benson, I know we mentioned this on the record in committee, but I do want to have it on the record on the Senate floor that you are willing to work to make sure that we deal with these unintended consequences. And like we said on the committee, that we're able to dot all our I's and cross all our T's to make sure that these provisions that were included here are not perfect and that will continue to need work. And I just want that on the record, that we're able to work with you to make sure that these provisions are actually workable.
Senator Benson.
Madam President and Senator Franzen, you have my word that whatever reforms we need in order to stabilize this market, to provide consumer choice, if there are things in this bill, for example, there were some concerns about surprise billing. So let's keep working on the questions raised around all the issues, including the ones you've raised today. I think we can do this well as we continue through the rest of this session.
Senator Franzen.
Thank you, Madam President. Thank you, Senator Benson. I appreciate those words, and I know that you been hardworking on this, and I know that some colleagues, like Senator Tony Laurie, deserves a lot of credit too, working for months on this work, on this important bill. I am also committed to working with all the stakeholders to make sure that this really is a policy that we can stand behind. I know that this provision in particular, the for-profit, came from the House, and it was very essential and important for them. It wasn't heard in the Senate, and it's not important and essential for our Senate version. But again, in the spirit of compromise, I am willing to move forward with the work that we've done so far in committee, and hopefully we'll be able to minimize those unintended consequences and bring some more transparency and accountability to the work that we did in committee moving forward. So with that, I appreciate Senator Marty's motion. I will vote against it, but not because I'm against the notion that he is supporting. Thank you.
Senator Abler.
Thank you, Madam President and members, and I appreciate the debate. And I don't want to repeat what anybody has said, but I want to remind people these are actually some very small changes and actually very necessary. I have been trying with others since October to get this relief done, and actually to get some items in place that will help Minnesota attract more choices. If you've been reading any news anywhere, all you hear is our nonprofits fleeing greater Minnesota, leaving Roseau uncovered 100 miles away to go to Thief River Falls, leaving 311,000 people uncovered in medical assistance come May. And so as policymakers, it's important to remember that if we pass something in March or April, that these insurance companies and plans and the ag co-ops, they don't decide on May 1st to do a plan and then get it done by May 15th. They need to decide even last year. For the provisions in this bill that move plans and companies to consider broadening their coverage, they have to start that now. That's why I'm a strong supporter of this, and I urge members to vote no on this motion, because we do need a chance to get these individual companies a chance to expand into Minnesota. Minnesota is an outlier, and so I mean, it is a risk. 49 other states somehow managed to survive the effect of a for-profit HMO. And I don't know if one will come to serve the individual market or not. But I do know that when you have more than one company who is available to do that if they choose, the other companies have to sharpen their pencil up. Let me explain how rates are set currently in our HMO market. Commerce approves their rates. We all know that. But what they approve is that they're high enough to cover the cost. But if they're excessively high, they cannot reduce them except by some kind of a bully pulpit. And that's what happened, in my opinion, in the latest rates, particularly with Blue Cross, where they've almost doubled the rates for an inferior plan because there's no one else. So Commerce begged them to come, and thanks to Blue Cross that they did that. But when a nonprofit acts like a for-profit, taking advantage of no competition, it's time for some competition. And I believe that even the thought that we're going to be bringing some for-profits into Minnesota will make that board of directors and their rating groups decide that they had better sharpen their pencil. Now, on the one hand, I just mentioned Blue Cross in a negative way. In a positive way, just to balance out my comments about them, on the continuity of care, the provision in this bill, which is a very good one, if it can be beneficial to the people who need the care, Blue Cross already does what this bill says. And so if nothing else, it sets a standard that for those individuals who are experiencing some horrific times will have the same opportunity in the individual market they already get in the group market. So in some cases, it's almost technical. But it's an important provision and one that needs to be emphasized so that these individuals who are even now learning they can't keep their doctor, tomorrow they can. So they can go through the challenges. They have 4 months at least to soft land into the new clinic and find a way to get the coverage that they need. And so just to remind you about back to the for-profit thing, they can't just come in and like make up whatever they want. They're actually going to have to bid. They're going to set up rates so people in Roseau could have more than one choice. Right now they have one choice. And that doctor or clinic is 100 miles away if they plan to use their health care. So maybe Roseau can have 2 choices. And if they don't want to pick the pricing that whoever comes in, or if Blue Cross opens up their markets to include those clinics, then they can choose that well. And that's really, really important. And so this is not a cavalier act. This is a principled choice to give Minnesota choices in their health care administration. We don't have a health care crisis. We don't have a health care problem. We have an administration problem of the clinics. We are just, on other bills that have been coming forward, we notice our network shrinking and consolidations happening. If there's more players, maybe they'll be more generous and let people continue with the doctor that they wanted. The Affordable Care Act says if you like your plan, you can keep it. If you like your doctor, you can still have them if it's going to be cheaper. Maybe by doing these kinds of things, that actually will happen. Members, I urge you to vote no on the very well-intended motion. Thank you.
Senator Isaacson.
Thank you, Madam Chair. I have to respond to one thing my esteemed colleague, Senator Abler, said, that it is never principled decisions when you hold healthcare relief hostage for reforms that serve special interest needs. That's just not a principled position, and to claim that it is disingenuous. The reality of this matter is that we're talking about maybe this might be some way in which we can look at bringing nonprofits in. And my experience in the legislature thus far has been very clear. That is absolutely the goal of certain members of the opposing party. It is absolutely the goal to move us towards a for-profit enterprise. So last evening, when I had the pleasure of speaking with the Majority Leader and Senator Laurie, it was clear to me in that discussion that the Majority Leader was unclear about whether that was the motive or the direction that was being headed, and I applaud him for saying, I'm going to go look at that and figure out what I want to do. I think that that's good for him to take that time to do that. But the reality is my experience in the legislature in the past has been very clear about the goal of certain members of the legislative body that that's where they want to go. There's no question about that. And so I'm concerned that this relief, being held hostage, allowing some of these other provisions to go on there, is really what we call setting the table. And that's a term that I like to use, that we set the table for future bills. That's what this bill does. It's the foot in the door to begin the process because they couldn't pass it outright. But you make incremental changes over time to some of these things, thinking you're going to get someplace down the road that I think is not good for Minnesota. And let me be clear, I'm an optimist. If Minnesota is doing something different than the other 49 states, I assume it's because we're doing it right, not wrong. And now I'm not saying that what we're having in healthcare is necessarily going the direction we want. But unless you're Mississippi or Missouri, where you can assume that maybe something isn't going the way you'd like, in Minnesota, I like to think of us as a leader. And I think that we care about our people's health care, which is why we're working on the system we have. And it is a mistake to continue to push forward with this bill, with those provisions, and I will be supporting Senator Marty. Thank you.
In response, Senator Abler.
Thank you, Madam President. And I offered most of my thoughts, but I just wanted to react to my colleague, Senator Isaacson. And, you know, I don't know all the members in my caucus as well as I might. I've kind of just been here 10 months. But I can tell you, no one's mentioned that their goal is to do anything untoward. And by the way, in the Senate, we don't question one's motives. We just question their action. You're free to disagree with their action about this particular activity, but to question how they might be motivated is entirely wrong. And so I know you didn't mean that. I'm just reminding you as we go forward with the discussion because I count you a friend. But also, we all care about Minnesota. There's 67 members of this body and 134 members across the hallway who care deeply. And how we express that caring is in different ways. And so, not to redebate the bill, but we can disagree on methods, we can disagree on timing, we can disagree on process. But I hope that no one ever says that any member of this body is not caring about the welfare of our great state. Thank you, Madam President.
Senator Dames.
Thank you, Madam President and members. I just wanted to speak a little on this situation. If you take a look at my district, I have communities that have one option, period. So when we start talking about adding more options, I'm getting a lot of support out of that part of the district. They would like to have options added. They would like to have more than one choice to purchase their health insurance. So I hear my community being mentioned by some of my colleagues here, and every community has about 80,000 people in it, or every district, I should say. So in my district, in defense of that district and some of the things that have been said about how some of the people in my district are what they're saying and what they're talking about, but there's a lot of people in my district that want to see this move forward. I've gotten a lot of emails since the conference committee was wrapped up. I've got emails from people that want the relief, to thank the conference committee and this body for getting that relief done. I've got people that have called me and thanked me for getting some of the reforms in this bill that they think are going to work well. I've got people call me and tell me they don't like some of the reforms. But usually the ending comment I get from these folks is, thank you for getting this done. I don't think there's a senator in this room can stand up and tell me at some point during the campaign last year they weren't looked in the eye and told, you need to go back there, you need to get your work done, you need to work together, you need to compromise, and you need to move these bills out, do things that are in the best interest of Minnesota. Now when you have compromise, let me remind you that there are things in there you're not going to like. There's things in this bill I don't care for. There's things in this bill I'm not happy about we're taking out. But it's called compromise. And I think that I think the House, the Senate, and the Governor's office worked very hard to move this bill forward. Everybody gave a little, everybody had to give up some, and that goes for everybody involved. And so that's the product we have in front of us is a product of compromise. And like I said, maybe not everybody likes it. Maybe there's things in there that give you a lot of heartburn, but there's certainly things in there that are moving things in the right direction. So with that said, I would ask that we vote against referring this back to the conference committee and ask for support in the final vote.
Senator Hayden.
Well, thank you, Madam President. I know that we are getting along in the debate, and at the risk of saying what has already been said, I listened to my colleague, Senator Franzen, very closely, and she was a member of the conference committee, and she's from my caucus, so I rely on her to help me understand what happens. And she said a lot that things needed to be vetted. Certain things weren't ready. We had to go to staff and ask them what might happen. There wasn't sure what the Attorney General might be. She even asked Senator Benson to assure us that if there were unintended consequences, that she would deal with the unintended consequences. Well, here's the problem with that. Typically, unintended consequences are things that you don't know that happens when you are doing the work. You typically don't say that there's going to be unintended consequences. That doesn't really work for me. If we know that there's unintended consequences, then that's what we do, is we take the time in this body to figure out what they are and to fix them. So I respect the work that conference committee does. I respect the work that my colleague, or our colleagues, but my caucus member, Senator Franzen, has made. And I think that that has really helped me, if I wasn't already predisposed to knowing how I was going to vote. I think that that really helped me to say why Senator Marty's motion to send it back makes all the sense in the world. Because there are these issues. And as to this issue that Senator Abeler and Senator Dames and our majority leader had talked about with respect to competition, well, members, United Healthcare is the biggest company in our state. It does work in all of these other 49 states. And I just did a quick Google search, and this past year they pulled out of Arkansas, Georgia, California, and many other states in the individual market. So what makes Minnesota different that they're going to bid in the individual market? Because that's what we're saying. They're going to bid into the individual market. They're going to go to South West Minnesota. They're going to go to northern Minnesota and all of these counties, and they're going to say, because we're a Minnesota company, even though we pulled out because we lost $500 million, $600 million, but in Minnesota, we're going to get in and we're going to give you more choice. We have all heard that Senator Latz, Senator Laurie has talked about quite eloquently what a for-profit company does. It is here to make money. It is not here to lose money. They pulled out of other states because they lost money. That statute does not, or that provision does not help get you access. I know it that's a little, that doesn't quite make sense, like, well, if we just get more people bidding. They pulled out because they can't make money. I think Senator Isakson is right, not in terms of people's motives, but in terms of him saying setting the table. Members, they are setting the table. If this is something that we want to do, we should take it through the committee's process. It is still January. We have not set committee deadlines yet. Senator Dames canceled his committee yesterday. Senator Benson canceled her committee yesterday. This is when we should be taking the time to go through this process so that my colleague doesn't have to sit in a conference committee trying to figure out if there are unintended consequences, or frankly acknowledging that there's unintended consequences. We should vet this. We are the Minnesota Senate. We have committees. We have 20-something odd committees that we're all part of, that we should go to each and every day and walk through this process. And we haven't done that. What we should do is we should pass premium relief. We should have did it in October, November, December. We should have did it the second day that we were here and got those dollars, that relief to Minnesotans. And all of these other provisions that the House wants, or wish lists that we've always wanted throughout the years, there is an opportunity to do that. It is to get a bill, sign up, put it in the hopper, right? Get it referred to the proper committee, and then as a chair of the majority body, then hear the bill, bring in the folks, notice it, bring in people from all over this great state and this great country, and have a conversation. Bring in the Attorney General, bring in whoever you want that can help us make this decision. But doing this because everybody else did it, well, that's not a reason. I can't go back to my district that says, well, guys, everybody else in the world did it, so I'm going to do it too. That's not the way we should do business. So I would urge my colleagues, based on really the information that I got from my caucus member who was in the conference committee, that she has made the point as to why we should re-refer this and do our work and come out with something that helps Minnesotans today, and let these other provisions go through and get vetted.
Senator Cohen.
Thank you, Madam President. I want to speak on behalf of Senator Marty's motion, but from a little bit of a different perspective. I spoke about this for a minute on the floor the other day, but want to add some other comments. And that's the source of the funding for this bill, the budget reserve. I note in the in the spreadsheet that's been passed out, I look at the numbers from the reserve as being $300 million going into conference, coming out of conference $326 million. And I want to express my disappointment that that continues to be the source of money for this bill. And I'll be honest, a source of disappointment with not only this body, with the other body, but with the administration as well, for not staying more firm on utilizing some other type of source. And let me try to offer some comments about this, and in particular to the new members of the Senate. Obviously, we have several people who served in the House previous to this term. But the budget reserve, which sounds to be something a little bit obscure, is not meant to be obscure. One comment I made on the floor the other day is I unfortunately take a bit of a proprietary interest in this budget reserve. Former Senator Skoye and myself, Senator Skoye as chairman of the Tax Committee, myself as chairman of the Finance Committee, put together the mechanism that provided an automatic transfer of a budget surplus, a portion of the budget surplus, into the reserve. And that wasn't by accident. The budget reserve is what we utilize for the budget downturns, the economic downturns, when we need the money to provide that source of income. To use it for ongoing spending during the course of a session is really a misuse of that budget reserve. We're coming out of a period of the largest post-war economic expansion that we've seen. If members might recall, obviously we had our own swearing in. We've had, at a national level, the presidential inauguration. We've lost sight of the fact that the last jobs report showed that the new jobs created were only about 150,000 jobs. That's a downturn from what's been happening over the last year to year and a half. I don't know if that's a trend or not. I'm very curious. Next week, the Council of Economic Advisors will have its first meeting in the promulgation of the budget forecast for March 1st with the state's budget economist. And I'm very interested to hear what the economists are going to say about where Minnesota is and where the nation is relative to that economic expansion. Because if we see some decrease in the economic expansion, we'll start seeing potentially, obviously, less money in our budget surplus. And I'm not suggesting that tomorrow we go into budget deficit, but I would suggest over the next 2 or 3 years that could well be a concern. And what we have then is a diminishment in the budget reserve. I recall in 2010, when as chairman of the Senate Finance Committee, I stood on this floor presenting the supplemental finance bill, and I thought to myself, I've had it. We were having deficits from 2002 through 2010, with the exception of a couple of years. And then obviously subsequent to that, in 2011 and 2012, we had huge budget deficits. I told members privately I was almost pleased during 11 and 12 not being chairman of the Senate Finance Committee. And I watched what the chairs of the budget divisions at that time went through in 11 and 12. And those of you who were here will remember that it was just difficult, just as difficult as anything I've ever seen. And in the process, we borrowed $2 billion from the schools. We cut budgets left and right. And I don't think anybody, majority or minority, enjoyed having to do what we went through. That's what we've tried to augment the budget reserve. And as we take money away from the budget reserve, as we do in this bill, we cut out what is needed for what is inevitably a change in the economic cycle. We can't control, sitting here on the floor of the Minnesota Senate, the national and arguably international economic cycle. What we can control is how we respond to it. That's what the budget reserve is all about. The other thing I would mention relative to the budget reserve members is the impact that our utilization of the budget reserve might have nationally. What we've done with the budget reserve over these last several years is made Minnesota a state that has become a national model. The bond agencies, the rating agencies, the national agencies use Minnesota as the model for how to build up and how to utilize a budget reserve. We've seen our budget rating go back up to, I think with the Fitch agency, a AAA rating. We haven't had that for years in this state. And that makes every bit of difference in terms of the cost of money to the state, in terms of a variety of things. And absent the budget reserve, we would not have that bond rating. As we start to take money away, I would expect we'll see the rating agencies, the national rating agencies, question us. They'll wonder why we're doing this. They'll wonder why the retraction from where we've been. So we'll see ourselves not be a national model. We'll see ourselves being held up as the negative side of what a state ought to do. I'm not aware of other states that have budget reserves, and nobody has built up a reserve like we have. Nobody has received the national attention we have. And again, these bond agencies, the rating agencies, are not a partisan group. They're not a Democratic group. They're not a Republican group. The bond agencies are totally a nonpartisan agency in terms of trying to determine what the fiscal stability of a state is or is not. And in utilization of the reserve for this purpose, we're going to see the rating agencies question where we are, where Minnesota is, what we're all about. And we hear a lot of talk on the floor of the Senate from bill to bill of where we are in terms of the schools, where we are in terms of human services, where we rank so high in business quality, whatever it is. We're going to see our ratings go down in terms of where the national rating agencies view Minnesota. And I'm very disappointed that this bill continues to utilize the budget reserve. That's not what this legislature has done over the last number of years ever that I'm aware of. And again, I would just go back to where we were from 2002 to 2012, where, as I mentioned, with a couple of exceptions, we faced deficit after deficit after deficit after deficit after deficit. It was a very difficult time to be on the floor of the Senate, to be a member of the Senate. And I would suggest that this reserve was there as the protection to not cut $2 billion from the schools, to not cut from higher education. I don't think any member of the Senate liked the degree of cutting. And we can have an argument about how much to spend and how much not to spend. But to reduce expenditures as we did in a way that resulted in displacement to every single person in the state of Minnesota is not a good way to run a state government. And that's why we have the budget reserve, to protect against those circumstances and those situations. Members, I would suggest that when you consider Senator Marty's motion, you not only think about the other issues raised, you think about where we are in terms of the fiscal stability of Minnesota. And that's why I suggested these comments are directed in particular to new members of the Senate who have not had the opportunity to hear a discussion of a budget reserve. That's not certainly somebody, as you went campaigning door to door during this past fall, that somebody said, what do you know about the budget reserve? I'll bet there's not a single person on the floor that heard that question. But once on the floor of the state Senate, it becomes our responsibility. And this is just a disappointment to see this kind of misuse of the budget reserve. We might not regret it today. We might not regret it during this year's legislative session, but I promise at some point we will regret it.
Senator Jensen.
Madam President, thank you. I want to be clear about motivation because it seems to be the flavor of the day to try to presume to know what other people's motivations are. I oppose Senator Marty's motion for several reasons. Number one, Senator Latz mentioned that we should ask our physicians how they feel about the for-profit companies in regards to prior authorizations and things like that. I'll answer his question. Quite frankly, when I see on a patient's card United Healthcare, I usually breathe a sigh of relief because that'll be one of the easier programs to work with. In terms of pursuing prior authorization, the for-profit companies are as easy or easier to work with than the others, and I'll say that clear. I enjoyed Senator Hayden's bashing of the for-profit companies. I was surprised. I appreciated Senator Franzen's comments. I think she's spot on, and she contributed immensely to the work of the conference committee. This bill has been scrutinized for adverse results. Before the sun rose today, I was talking with physicians about this for-profit piece. I met with Medica. I met with Blue Cross yesterday. I met with Health Partners. Quite frankly, the not-profit companies are fine with this. And there is statutory protection against allowing them to capture the reserves. Those are public dollars. I agree with Senator Laurie. But I don't think that we've set up some free-for-all. So it's with no hesitation at all that I say to Senator Hayden when he said, we should have done it in October, we should have done it in November, we should have done it in December. Well, by George, we can do it now in January, just as the governor has asked us to do, just as the governor has approved this plan. This bill is a solid first step. I speak against Senator Marty's motion. Thank you, Madam President.
Further discussion. Senator Benson.
Thank you, Madam President. Just to address a couple of things that were raised with regard to special interests. I believe our conference committee was focused on the special interests of Minnesotans, working on relief and options for them. With regard to hospitals and doctors, both the Minnesota Hospital Association and the Minnesota Medical Association issued letters to the conferees, and they did not raise in those letters for-profit HMOs as a concern specific in this bill. And with regard to hearings, the for-profit provision was in Senate File 56 in Human Services and has been in Senate File 1 all along. With regard to the movement on budget reserves, we did move to the governor's position, which added $26 million to this bill from when it left the floor. Members, I would urge a no vote on the Marty motion.
Senator Marty.
Madam President, just a reminder, this is would not stop the bill. We had a good, 45-minute discussion over this. It would take the conference committee probably 2 minutes It's delete sections 4 through 9 and 1 or 2 of the repealers. This would not stop it from passing today. We could pass it today, just send it back to conference committee. 10 minutes of work, 2 minutes of work, we can pass it. This is a permanent provision. The part we're all focused on is one-time provision. I think almost everybody here supports it. I'd love to vote for the bill, but I can't with this provision in, and I urge you to send it back for 10 minutes of work.
Seeing no further discussion regarding the Marty motion, Senator Marty renews his motion that the recommendations on conference committee reports on file 1 be rejected and that the bill be re-referred to the conference committee as formally constituted for further consideration. Members, just as a matter of instruction, a green vote on this motion would send the bill back to conference committee. A red vote will continue the discussion and bring Senator Benson's motion back. So green will send it back. Secretary will take the roll on the Marty amendment, or Marty motion, excuse me. All those senators having voted who desire to vote, the Secretary will close the roll. There being 30 ayes and 36 nays, the motion does not prevail. We now have in front of us Senator Benson's motion to accept the conference committee report. To that motion, Senator Benson.
Thank you, Madam President. In addition to the items that I raised in the initial presentation of the motion to adopt, I want to remind members, agricultural co-ops are in this bill. Thank you to Senator Abler, who's been pushing that along since October. Changes to stop-loss provisions and conformity to federal defined benefit plans. We're working with these 3 provisions, we're working to create more options for Minnesota farmers and for small business owners to provide insurance options for their employees and for themselves. With that, members, I hope that we can move this conference committee forward.
Further discussion, Senator Limmer.
Madam President, I impose a call of the Senate.
Senate is under call.
Said the MMA, the MHA, and there's been no position that's come forward. And, our key message, I get what you said, but this is as good as it's going to get. Julie Rosen's here Monday. Need a highlighter pen? Vickerman used to always.
Senator Limmer, and just may I clarify, it is for the duration of this motion?
Yes, Madam President, for the duration of the Senate File 1. I move
Senator Limmer for the entire conference committee report.
The entire bill.
Thank you.
Madam President, I move that further proceedings under the roll call be dispensed with, and that the Sergeant of Arms be instructed to bring in absent members.
On that motion, all in favor say aye. Those opposed, no. Motion does prevail. Further discussion on the Benson motion. Senator Klein.
Madam President, I rise in support of the Benson motion. I rise in support of Senate File 1. When we last saw this bill, I felt that Democrats and Governor Dayton had the best plan to address premium relief in the fastest and most efficient manner. Senate File 1 returns us from conference committee with Governor Dayton's plan for immediate relief intact. When this bill passed through the House, some toxic amendments were attached that would have reversed our vision of working toward health care access for all people and returned us to the days when people who developed cancer or diabetes would bankrupt their families in a struggle to stay alive. Those toxic amendments have been removed. I share my colleagues' reservations about allowing for-profit insurers to enter the Minnesota market, possibly to exploit some of our poorest citizens, and possibly to loot our public dollars. And I think I share the reservations of every member of this body that we are spending $300 million of our precious reserve fund on a temporary fix. But Madam President, we have rushed together to address a desperate emergency. Democrats and Republicans, House members and Senate members, we saw Minnesotans in distress and we ran to the scene. I will vote yes to pass this bill today, but harder work lies ahead. We will need to trust each other and to share ideas to diagnose and treat the underlying problem. We can't spend $300 million next January on this same issue. Governor Dayton has proposed an expansion of Minnesota Care and a public option. I urge the members to consider the benefits of such a proposal in future days. It gives Minnesotans the opportunity to purchase an insurance product at a reasonable cost, and it gives us some control over rapidly escalating health care costs by asserting reasonable priorities about health delivery and negotiating better terms for costs. And it can continue our very natural trajectory towards fulfilling our moral obligation as a society to ensure health care access for all Minnesotans. Thank you, Madam President, and it is my deepest hope that my yes vote today will pave the way for very necessary conversations and compromises that will be needed in the months ahead.
Senator Johnson.
Thank you, Madam President, members. I rise in support of Senate File 1. I support the conference committee inclusion, in particular, of an amendment allowing the appeal of the process of health care providers affected by network adequacy waivers granted by the Commissioner of Health. This change in law is a basic due process right. It gives the right to appeal the waiver in an effort to include local health care providers under a given health care plan. Senator Abeler has made comment to Roseau that has been particularly hard hit by this waiver that was granted in Roseau County. What's happening up there is individuals with a particular plan are forced to drive 90 miles away down to Thief River Falls to be cared for in their facility down there. This, of course, brings a large burden on those individuals as they drive right past their local hospital and clinic. So I would like to thank Senator Benson and those on the committee for all their hard work that they've done in putting this bill together. I think it's a wonderful bill, and I urge your support in Senate File 1. Thank you.
Further discussion on the Benson motion. Senator Kiffmeyer.
Thank you, Madam President and members. I rise in support of Senate File 1. I spoke before about the people out there. This is what it is. It's about our people, all of our people. They're absolutely terrified right now that we might not do something, and they are seeing their premiums skyrocketing. This is urgent, it's important, it needs to be done now. But they're also equally terrified about the future and that they'll be here again next year. And if you think the price tag is steep this year, without these reforms, that price tag goes sky high. We've got to have these kinds of reforms and market reforms, increased access, so we aren't here next year. Those people deserve both, and we are capable of doing both. This bill has taken a very measurable step forward in that regard, and I'm confident that we can work together amongst ourselves and with the governor to make this a more permanent consideration for all the people of Minnesota. Thank you, and I urge your support for Senate File 1.
Senator Laurie.
Thank you, Madam President. Let me start by thanking Senator Benson and the Conference Committee for working hard on this issue and bringing this forward. I need to say for the record that I'm very glad to see a workable subsidy program actually on the verge of getting passed today. I'm actually really glad to see the continuity of care, the really important continuity of care provisions included in this bill that will help many people in a current course of treatment that may otherwise be disrupted in that. That said, I'm very disappointed that I'm actually not going to be able to support these provisions that I have worked so hard for so many months to try to bring about. I know that last year, at the beginning of last year in January, we foresaw some of these rate increases and the worries, particularly in greater Minnesota and particularly for elderly people who are approaching Medicare but not yet there with the 3 times rating factor. These rates have really caught up to some of these folks. And Senator Skoye and I worked between tax staff and HHS staff and crafted a pretty good tax relief for Minnesotans not eligible for the advanced premium tax credits, that had we been able to pass that, Senator Schmidt carried it. Had we been able to pass that, we wouldn't be here in this position today. It would be a very different thing. You know, this is my 11th session in the Minnesota Senate, and I've been sitting here trying to remember a time when members of this body stood up and said, you know, the things that we're going to send to the governor's desk that he's pledged to sign aren't actually ready for prime time. They need work. They need to be reviewed more carefully. There are accepted unintended consequences. I just can't think of a time that we've asked members to pass a law that we've acknowledged on the Senate floor is not ready for prime time. This is new and very disappointing. You know, our entire system here for passing laws is specifically designed to have safeguards and you know, a deliberative process in place that makes it very difficult to pass a law. Very difficult to pass a law, again, by design, because this is important work that we do. And we need to be held accountable to the people of Minnesota, and that's what our process is designed to do, hold us accountable for the decisions that we make. And, you know, when in the Senate, we stack committees, abuse the process, break the rules in order to get things on a fast track, especially in the midst of one of, I can attest, the most complicated areas of our state statute. You know, healthcare is really difficult issues, and it's risky and dangerous to be making changes in this area of statute without going through the process, listening to what all of the stakeholders have to say. You know, I watched peripherally many of the conference committee. To the best of my knowledge, there was no testimony, no public testimony offered within the conference committee process. We sped through all of our committees. We didn't have fiscal notes. You know, one of the ones, the network adequacy that was just talked about, that is a really important issue. I mean, I too represent an area that has inadequate networks that are very problematic. But this appeal right for providers that sends them to a contested case hearing, I honestly believe could have been made better. This is probably holding out a false hope. I would encourage people to contact their nursing homes who have right to go through contested case hearings on various Minnesota Department of Health rulings in their regard. They are a very cumbersome process that take at least 6 months to work through. They are very expensive. We don't even have any, you know, I looked at Senator Benson's estimate of the fiscal costs here. There's nothing on here. Contested case hearings are not free. They're actually very burdensome. If we have maybe 6 of them, it's actually a fairly significant cost to the state of Minnesota. That's if 6 providers choose to contest the exclusion from the networks. Again, a very serious problem one that I would very much like to be a part of the solution for, but I think that this is an incredibly cumbersome, administratively burdensome, and expensive process that holds out false hope to rural providers that really need some relief. As far as the being held accountable, Senator Jensen talked about actually really reviewing this bill in a very thorough manner because he had meetings in the privacy of his office with stakeholders. Well, that's not what we do here. We actually have public open meeting laws that require us to have hearings in the public and listen to what stakeholders have to say. Not go into our office and deal with stakeholders and listen to them and make whatever deals we do, put them in the statutes, and then put them in our statute books. That is not the way that we hold ourselves accountable. And I am just very, very saddened to be in a position where I'm not going to be able to support this bill. I've been working very hard to get this subsidy out to people for a year now in different manners. You know, the governor's plan, which is the only workable one after Blue Cross pulled out in June or July, and the rates became public and were astronomical in their increases. And, you know, Governor Dayton put out in October this plan. I was here, I think, every week throughout October and November and December and trying to work with stakeholders to get this done. It's time to get this done, but I think we could have done it in a better way, and I think we could have done it with a unanimous vote. And we could have gotten to some serious reforms and had the conversations over the last few weeks in a real manner where we engage stakeholders in the way that we're expected to by the people of Minnesota. And, you know, I'm sad to see this bill in its current shape and hope that we can do better in the future. This is not getting this session off to a good start.
Senator Schoen.
Thank you, Madam President. Process. That's what this bill lacked. And we can say that it had hearings, but it was split up into several different pieces. It happened at the same time in the House. Our commissioners, those interested parties were showing up at committee hearings out of breath, sweating, trying to race back and forth to give us some answers that we truly didn't have. Here's the one thing we don't know. How much is it going to save us? How much is it going to drop prices for our, in the long term, these reforms? How much are Minnesotans going to save? What we don't know is what will this for-profit insurance inclusion include in Minnesota, because once again, we had a rushed hearing process, committee process, that didn't have Minnesotans in. It wasn't open as it should have been. That's just not good governance. I hope moving forward that we won't continue to do this. At the end of last session, Minnesotans watched us and were appalled. And that's owned by Democrats and Republicans, and it just shouldn't continue. I'm sorry to say that that's what happened here, but this is not good governance, and this is not how we make good policy.
Senator Newman.
Madam President, I rise only to take issue with the comments that Senator Laurie made with respect to contested case hearings. My experience is that it is not a cumbersome process. I will tell you that the rules of evidence and the rules of discovery are relaxed. It is usually a much shorter process or trial than, for instance, in a trial through the judicial system. There is no jury. There is an administrative law judge that makes a decision fairly quickly and then passes it on back to the state agency. And finally, most of the time people appear without an attorney, and the administrative law judge is then required to at least give them some assistance. So I rise only to that point that Senator Loy raised with regard to the difficulty of contested case hearings. Thank you, Madam Chair.
Senator Champion.
Thank you, Madam President. I rise narrowly to contest what my good friend, the good senator, had to say around contested hearings. Contested hearings, Madam President, requires one to understand the legal process, requires one to file the necessary documentation in order for there to be a hearing. A person who does not have the intellectual capacity around the law is put at a disadvantage. They're put at a disadvantage to even understand what the relaxed rules of law are, not to mention the fact that they don't have the wherewithal or the finances by which to get solid legal representation. So when my good friend says that the administrative law process is relaxed, is clear, is the people's court, it is not the people's court. And in fact, it is far from the people's court. We think it's really important whenever someone is going through the legal process to have insight and also to have the ability to articulate their position with clarity so that the administrative law judge who's going to make a recommendation to the commissioner can do so, or whoever the deciding body is. So just for that narrow purpose, I rise just to say that I think it's always important to make sure Minnesotans understand their legal rights, have solid representation, and that there's a process or mechanism before them where they can articulate where their challenges are so that the decision maker can make a decision. So with that being said, I am challenged by that provision because when you do a contested case hearing under Chapter 14, it is cumbersome, it is challenging, and it is also uncomfortable. Thank you, Madam President.
Seeing no further discussion, Senator Benson renews her motion that the foregoing recommendations and Conference Committee report on Senate File 1 be now adopted and that the bill be repassed as amended by the Conference Committee. The Secretary will take the roll. All those having voted who desire to vote, the Secretary will close the roll. There being 46 ayes and 20 nays, the motion is adopted. Secretary will give Senate File 1 its third reading.
Senate File Number 1, a bill for an act relating to health care coverage, providing a temporary program to help pay for health insurance premiums.
Third reading. We now have in front of us Senate File 1, Senator Westrom. I'm sorry.
There, Madam President, just wanted to offer a few comments, Madam President, specifically relating to the ag co-op option in this bill, and I think it represents what citizens and what the system has needed is more options for individuals, for farmers, and for other people looking at different ways to provide health care or band together in a group. And so I raise this point because I think it's important for us to use this as a beginning to continuing to find more ways to bring health care options to the citizens of the state of Minnesota. And I'm puzzled why we wouldn't open it up to more, but this is a good beginning. Farmers and others involved in agriculture will welcome this opportunity. I think it's good for us as a state to be promoting these types of options. And I think months ahead or years ahead, we should be looking at allowing others to band together and cooperatively form their own networks or groups as well. And so I want to highlight that part of this bill. It's a good reform, a good option to bring to the citizens of the state of Minnesota, as well as the other provisions bringing back more competition. But again, we need to look at more down the road. One of the parts that I look forward to, members, is also looking at county-based purchasing groups like we have in my district, Prime West, to allow them to maybe offer some of the same types of opportunities to rural counties and to other counties throughout the state. And so I'm hopeful we can bring that forward as a additional reform this year.
Senator Nelson.
Thank you, Madam President. Well, we've had quite a discussion here today, and I think there's one aspect that we haven't talked about, and that is the fact where we were in Minnesota before the advent of the Affordable Care Act and Minnesota's version of it, and why we're here today. Prior to the government's involvement, Minnesota had one of the highest health insurance participation rates in the nation. We also had a market that was working for those with pre-existing conditions, the MSHA market. That was working. We were insuring people with pre-existing conditions, and their rates, their premium rates, were held down through the MSHA assessment. So that was working. We also allowed young adults to stay on their parents' policy if needed up until age 25. That was already in play. But what happened when the government Affordable Care Act, or whatever name you choose to call it, and the Minnesota version of it was really brought down to Minnesotans? And let's just say that there were no Republican votes supporting that. And yet, that's what we had. That's what we have been dealing with. And so today we are sitting here trying to right the ship. The ship that was sailing along fine until government intervened. It wasn't perfect, but it wasn't sinking like it is now. I want to tell you just about a couple of the constituents in my district. Husband and wife with $40,000 annual premium. That's not insurance, folks. That's a broken system. We cannot afford that type of system, and we are seeing small businesses, entrepreneurs who are going out of business because of this insurance crisis. So while I heard the concerns about the bill before us today, let me just say that it is time we get the relief out. And it is time that we start doing what we can to reform the market and bring more choices to our consumers.
Seeing no, Senator Klein.
Madam President, there's a persistent and recurrent narrative that we lived in an idyllic state of health care coverage and health care delivery in Minnesota 10 years ago, before the Affordable Care Act arrived. And let me tell you from very personal experience, that is an absolute falsehood. I cared for patients for the last 20 years in various settings, but most recently at a safety net hospital in Minneapolis, Madam President. And I can tell you that I can tell you about one patient who came into Hennepin County Medical Center, a young man who was working as a waiter, had no health coverage whatsoever 10 years ago. and he had cut his hand at work. Like most young people, he waited around and thought it would get better, did not want to incur costs for a simple cut by coming into the hospital. He left it to fester for several days. Hand injuries and infections are especially dangerous because of the many planes of tissue, and they can spread rapidly, as you know. And this gentleman, 21-year-old gentleman with no health insurance coverage, finally presented to me, Madam President, with clinical sepsis and required intravenous antibiotics and fluids and several days of hospital care. We were fortunate to save his hand. That was what health care looked like in my world before the Affordable Care Act, Madam President. To narrate that health care was fully covered and idyllic in Minnesota 10 years ago before the government intervened and destroyed it is a false narrative.
Further discussion. Senator Benson.
Thank you, Madam President. Senator Tomassoni, it looks like we'll be simpatico on this. I appreciate your vote. And I appreciate the votes that got us here today. We are in a time of compromise. To get anything done in this 90th legislative session, we are going to have to work on compromise. I'd like to thank Senator Abeler and Senator Laurie for the work they have done for years, and in particular the intensity of work since October. I'd like to thank my conferees, Senator Franzen, and her contributions, especially. I want to thank the governor's office for making extra time for me to walk me through to make sure I understood where they wanted to be and how they found it possible to get there. And I want to thank Commissioner Franz. I looked through my phone. I have a number of phone calls to him and from him after 9 o'clock at night, just to be clear where we were going as we worked on this compromise. To the people of Minnesota who we want to benefit from this bill, and I believe everybody in this body, regardless of how you vote on final passage, wants this bill to move forward for the benefit of Minnesotans. To the people of Minnesota, you have been heard. You are not forgotten. To the farmers and small business owners, to the entrepreneurs on our main streets who are worried, we are listening. We are doing our very best to get you help today. This is the beginning of many discussions on health reform. This 90th session, every single day, we will be thinking about you. And with that, members, I appreciate your support with a green vote on this bill.
Secretary will take the roll on Senate File 1. All those senators having voted who desire to vote, the Secretary will close the roll. There being 47 ayes and 19 nays, the bill is passed. And its title agreed to. Remaining under motions and resolutions, we will take up the Dibble motion. Senator Dibble.
Thank you, Madam President. Madam President, I move that Senate file number 207 be withdrawn from the Committee on Environment and Natural Resources Finance and re-referred to the Committee on Capital Investment.
To that motion, Senator Dibble.
Madam President, this is a bill that is of capital investment in nature, and both chairs have been informed and agreed to this change.
On that motion, all in favor say aye. Aye. Those opposed, no. The motion does prevail. Moving to 13th order of business, announcements of Senate interest. Senator Matthews.
Thank you, Madam President. Members, 1 week ago today, our state all heard the news of 3 high school students, Ian, Beckett, and Greta, attending the Rogers High School, who were struck by a pickup truck driver who failed to stop for a school bus stop sign. And this struck home especially to my family and my relatives because one of them, Beckett Olson, is my cousin's son. And though his healing is just beginning, he faces a long road of recovery ahead of him. And this is an important and sober reminder to all of us members and to all of us Minnesotans of the importance that we place upon ourselves for stopping for our school buses, for stopping for our emergency responders, and for our law enforcement. And remember this, because the next time that you're tempted to be frustrated on the roadway, that it could be someone's son or daughter or mother or father or relative or close friend that's at stake. And so we voluntarily insure ourselves, we voluntarily inconvenience ourselves for the betterment of others in these situations. One fact about my cousin Beckett is that he loved wearing bow ties. And so as he starts his road of recovery, Madam President, his family is starting a drive through his school, through friends and family, with the hashtag Bow Ties for Beckett. And Madam President, as you can see, I'm joining that drive today. I'm encouraging all you members and all Minnesotans to join me in the Bow Ties for Beckett drive and to continue to pray for the full healing and recovery for Greta, for Ian, and for Beckett. Thank you.
Thank you, Senator Matthews. Further announcements, Senator Limmer.
Thank you, Madam President. Members, on your desks, I have placed a little note offering the law school for legislators. That's for tomorrow at the Mitchell Hamlin School of Law. It's hosted by the Minnesota Association for Justice. This is an annual event that they offer to not only legislators but staff. And for those of you who are attorneys and need to add on a few credit hours of continued education, this is equal to 6.5 hours, and I believe there's no cost. So if you haven't, they have now told me they are at a record number of participants for tomorrow, but there's still room. If you would like to participate, you're more than welcome, but you will need to call the phone number or an email on the back because they need to make absolute room for you. And that's all I have to say about that, Madam President.
Further announcements, Senator Matthews.
Thank you, Madam President. An announcement to the Committee on Energy and Utilities, Finance and Policy will be meeting 15 minutes after the adjournment of session in room 1150 of the Senate building.
Senator Kiffmeyer.
Thank you, Madam President. The State Government Policy and Elections Committee will be meeting at 1:15 in room 1200.
Senator Senjum.
Thank you, Madam Chair. I'm not sure if Senator Bach's going to say anything or not, but I'd certainly like to thank him for this wonderful roster of, I believe, the 1,367 past senators that served in this room. Thank you.
Senator Limmer.
Madam President and members, and as well as the public, I made this announcement in the Judiciary Committee yesterday. The Judiciary Committee for Monday is not meeting. So I know that our members were there. There were very few people left in the room when I made that. This is just as a reference to a public announcement.
Further announcements. Senator Gazelka.
Madam President, is it still against the rules to clap during session? So may we
It is still against the rules, yes.
May we take a brief recess so I can make some comments about the governor?
Senator Gazelka has moved for a brief recess. All in favor say aye. Aye. Those opposed, no. We are in recess.
So, Madam President, members, first of all, it's the governor's 70th birthday today. And you know, maybe he's watching out there, so maybe when I finish, we can sing happy birthday to the governor and clap. But I want to tell you, Monday night was an incredible, scary moment. And yet I watched how we responded, and I was so proud of the Senate. Very proud. And even kudos to the House. You saw Senator Klein and Senator Jensen immediately came up to the front. The House had 2 members that were EMTs. They responded quickly. It didn't matter what side of the aisle you were on. There was a barricade that was formed kind of between where the governor was and the media because we cared. And it's just one of those moments where it profoundly impacted me. And just different things that happened to me personally with people on the other side of the aisle, and it was just like, this is what Minnesota's about. This is what we're about. And so it's the governor's 70th birthday, and I would like to sing happy birthday to him right here, and he can get it off, get it on the media, and then clap for our governor. So. Happy birthday to you. Happy birthday to you. Happy birthday, dear governor. Happy birthday to you.
Senate will come to order. Thank you for warning me that you were going to clap so we could go into.
Well, Madam President, I'm trying to follow the rules. So.
I have one announcement. Without objection, the following senator will be excused from today's session. Senator Rosen, all day. Senator Gazelka?
And Madam President, just before we adjourn, one thing that was removed from that file was reinsurance, and it was because we weren't quite ready for prime time, but that really is one of those other areas that's urgent. We're looking for input from both sides of the aisle on that. It's important that we get that done early, as in by March, so that the plans know what their options are going forward. So I just want to give you a heads up on that. And now, Madam President, I move that the Senate do now adjourn until Monday, January 30th at 11 a.m. Wait. Oh.
No. Senator Gazelka has moved that we adjourn until Monday, January 30th at 11 a.m. All in favor say aye. Aye. Those opposed, no. We are adjourned.